Vaccine recommendation changes. So many things to unpack, so much politics involved, but I like to focus on the science and medicine, so let's do that. Basically, the president, in December 2025, asked the U.S. Department of Health and Human Services to look into the 2025 recommended vaccine schedule and to refine it to reflect, quote, superior approaches in other countries. The HHS outlined their research in their 33-page document and found that, quote, peer countries achieved higher success rates of vaccination by not mandating vaccines. The brighter the green, the higher the percentage of vaccination. But in reality, this table doesn't look at all of the factors that could be contributing to these differences. For example, what is the incidence or prevalence of these infections in these countries? And also, how is the structure of their healthcare system differ from the United States? Nevertheless, after their analysis, HHS decided to change their recommended vaccine schedule for childhood from this to this. They also included 2 additional tables. The purple one is recommended for high-risk groups, and the blue one is based on shared decision-making with your doctor. The change in the recommended vaccine schedule was ultimately made to improve public trust in the healthcare system. And you know what? I agree with this goal. A person's health is dependent on 3 things. 1, their lifestyle, making healthy choices when it comes to their food, how much exercise they get, their recreational practices, as well as their sexual practices. Second is the knowledge of health, being in tune with their body so that they can perceive the slightest of changes in their health. The third is trust in doctors and the healthcare system, believing that their doctor will hear them, have their back, and adjust medical care to fit their goals is key to having good health. My goodness, I cannot emphasize how much I agree with these 3 concepts. I want to take a moment to say that it's true that public trust in healthcare was lost during the pandemic, but I need people to understand that just like for every non-medical person, COVID-19 was new to medical persons as well. Mask mandates and vaccine mandates were made to protect and to stop the spread, not to cause discomfort or pain. I hope this becomes more clear in the coming years as the healthcare system builds a better relationship with the public. I want to make it clear that I am worried about public health when it comes to removing these 6 vaccines from the recommended vaccine schedule. I worry that the HHS didn't look into the decades of research that has already been completed. I worry that money is being poured into more research when in actuality, money is more so necessary to figure out how to remove health disparities and how to make healthcare more accessible to every single person in the United States. We should be looking into spreading trustworthy education and how to stop the spread of misinformation. I worry that over the coming years, the already low rate of vaccination will dwindle further. I worry that that will impact herd immunity, which is the whole point of vaccination. With this video, I urge the following. To the general public, please know that your good health is the #1 goal for healthcare professionals. To my medical peers, spend a little extra time explaining yourselves so that your patients can walk out with more knowledge and understanding about themselves. Let's align our goals. Thank you for joining me in this video. If there's anything that you want me to explain further, please comment below or feel free to email me privately and I will keep things confidential and answer your questions within the email or within a future video. Please subscribe for more medical tidbits. Thank you.